The custom endosteal implant supported overdenture aesthetics. This lesson will cover the restorative aspects of the implant supported removable overdenture, and we'll go over the orthodontic contribution to aesthetic dentistry, and also we're going over some of the old Accu-dent Geneva 2000 that established great aesthetic techniques. Orthodontic's contribution to aesthetic denture construction. Dr. Andrews is an orthodontist, and he studied many cases that had perfect occlusion and came up with 6 keys of occlusion. Several of these keys are apropos to denture setups. The proper tip or inclination and the torque angulation of the teeth, flat to minimum curve of spee, and the denture teeth are set differently depending on the orthodontic classification. Perfectly set teeth can look normal if the keys are followed exactly. Normal tip or inclination is the mesiodistal rotation of the tooth. The torque or angulation is the buccal-palatal or labio-palatal rotation of the tooth. In orthodontics, the tip and the torque is built into the bracket. So when we properly place the brackets on the teeth, the roots tip and torque into their proper orientation. The arch form in a perfectly set up upper denture, there's a curve that runs from the cuspid to the cuspid, and then from the cuspid posterior it runs on a straight line. In the smile, this translates into the buccal corridors. The inclination angles run from a -7 degrees at the cuspid to a -9 degrees in the molar area. The gum line actually varies from the cuspid to the lateral incisor to the central. It starts at its highest point at the cuspid, drops down for the lateral, and then rises again for the central incisor. The central incisor has an angulation of 5 degrees. The lateral increases to 7 degrees, and then the cuspid goes out to 9 degrees. In other words, from the central to the cuspid, the roots angle a little bit more as they go distally. The inclination of the angles from the cuspid to the second molar angle to a negative degree as they move distally. The central incisor has an inclination of about 7 degrees. The cuspid has an angulation of about 11 degrees. And according to Andrews, there's a flat curve of spee. By studying the angles of normal occlusion, you can produce natural aesthetics. The teeth can be set perfectly straight without that artificial look. The position of the 2 central incisors, the front edge of these teeth are about 6 to 7 millimeters from the incisal papilla. The Accu-dent Foundation contribution to denture aesthetics. Dr. Fresh founded the Accu-dent Foundation over 40 years ago. He retired about 15 years ago, and the techniques he has taught have all but been forgotten. Dr. Fresh studied denture aesthetics from a German dentist, Dr. Zeck, whose father was a famous sculptor at the turn of the century. Dr. Zeck studied the anatomy of actual natural teeth and found differences between sex, age, and personality. Natural aesthetics were produced from these studies. Basics for producing natural aesthetics. The aesthetic control base, ECB. The vertical dimension at rest. Relaxed lip support determines the bite. This position gives the patient the maximum bite opening possible. The technique has a facelifting effect. The allometer, the papilla meter used to communicate to the laboratory the dimensions of the aesthetic control base. The midline, smile line, and upper lip line. Characteristics of a normal smile. When looking at a beautiful person, the teeth should not be prominent. They should fit within the person's smile, and they shouldn't be noticeable when somebody is looking at that person. Teeth set to normal orthodontic norms just look normal, and comments about their smile or about their appearance is, gosh, you look great today. To get this beautiful smile, we start out with the smile line. Usually the smile line follows the lower lip line. The next element of the perfect smile is the upper lip line. When a patient smiles their widest, we want to mark that upper lip line so that the patient doesn't have a gummy smile. Another essential part of a perfect smile is the buccal corridors. When a patient smiles, there should be spaces between the buccal surfaces and the corner of the lips. There's nothing more fake looking than when the teeth fill out that corner. The relaxed lower lip line is very important as well. For elderly patients, that lower lip line is right at the tip of the incisors. For younger patients, those patients show a lot more teeth when they smile, somewhere up to 3 millimeters. Once the bar supporting system is determined and constructed, The removable custom endosteal implant supported overdenture is constructed in an identical way as traditional dentures are made. In this case, the Swiss-dent techniques will be detailed. The maxillary overdenture impression is done without cementing the bar superstructure onto the abutments. This saves time during the overdenture construction. If the bar is cemented, it is necessary to grind out the soft liner and hollow grind the temporary denture to fit over the bar. If the bar is not cemented, then the bar will come out with the impression. Remove the hydrocolloid material from immediately under the bar, remove the bar, and then pour up the impression. The impression uses a dual hydrocolloid material called Accu-gel. It is a heavy-bodied tray colloid and a light-bodied syringe colloid. The light-bodied material is mixed first, and then the heavy-bodied. The light-bodied material sets slower, so that either one or two operators can mix the material. The light-bodied material is mixed first and placed into a delivery syringe. The heavy-bodied material is mixed and placed into a stock tray. The material is heaped up in the front of the tray and tapered to the rear. This facilitates a good buccal roll in a final impression. The light-bodied material is injected around the buccal and facial vestibules. Additional material is injected into the anterior palatal area. The tray is gently placed in the patient's mouth, starting with the anterior buccal roll material in the vestibule under the lip. The tray is then seated from front to back. The material is heavy-bodied enough not to run down the patient's throat. The patient is instructed to breathe through their nose and everything will be comfortable. This action blocks material from sliding down the patient's throat. Plus it suggests to the patient that the impression will be comfortable and they will not gag. You see that? We're going to syringe it into the material all the way back to the buccal. Just have the patient relax his lips a little bit into the palate, and then we take the heavy body and we start it from the front. Relax your lips, let your lips relax, and just watch the roll go up into that buccal fold, and just gently seat it and just roll that material over. And it takes only a couple minutes to set up. But you can see how one operator did this mixing. I mixed the light body and the heavy bodied and still had plenty of time to seat this into the patient's mouth. The material is already setting up. It sets up fairly fast. As you can see, it doesn't roll down the patient's mouth. And Mr. Gray actually is not a gagger, but for gaggers, we just tell the patient to breathe through their nose, and the tongue comes up in the back and blocks the material from going down the throat. And say, just breathe through your nose and this will be comfortable. And I've rarely ever had anybody gag on this material. To remove this material, don't use the handle as a handle, but just take your fingers up under here and then just kind of work it out until you hear the suction release. And as soon as the suction releases, then it comes out. And see, the bar came out with the impression. And before we pour up the impression, we're going to take out the alginate material right under the bar, and then we're going to take the bar out and pour this up without the bar. The bar comes out with the impression. The alginate material over the bar is trimmed away before pouring up the model. The model is poured with laboratory stone, and the final model is trimmed. What the laboratory needs: the papilla meter reading from the patient. Place the bar in the mouth and measure the distance from the bar to the lower lip. Okay, now we're going to do some measurements, and this makes it so much easier to work with a laboratory when you have some of these tools. This is called a papilla meter, and it's to measure the lower lip line of the patient. So we can take that measurement back to the laboratory and actually have an aesthetic control base made that will when placed back in the mouth will be very close to where we want it. We put the bar back in, the little stop here fits right onto the bar. If you're doing dentures,